It's David here, greeting you all, and really delighted to see that we're together here once again as a family. I'd like to say hello to Chris from Live Illustration. Chris Shipton, this is a chance to say to you how grateful we are to all you and your colleagues from Live Illustration for capturing what I believe to be a really important growing story that we have at the moment on what is actually going on around the world. I'd like to take a chance just to greet everybody individually, to Annie McLeod and Bob Schneider, to Yusuf, thank you, to Marianne, Annie Feltham, Joey and Zara, Terry Jackson, Louisa, Walter Schneider, Carlos and Veronica from Cancun, Godfrey from Tanzania, Sarah, lovely to see you again, Shadrach, Georgina, Travis, hello. And I just want to say hello to Shilpa, just joined. Sherry, thank you for being with us. Sherry and I worked together on a number of issues over the years, and I'm delighted that she spared the time to be with us today. Jane, thank you for joining again. And Chris, thanks for joining from Duke University. Holly, great that you're with us to focus on leadership. Rutty, thank you. Carl Taylor, Rojan from Kathmandu, lovely to see you. Vicky, thank you for sending the latest song from Nazim. Abdullah, it's lovely that you're with us. Everybody, there were more who joined, and Ruti, I've just seen you as well. I just wanted to give a shout out to as many people as possible, because really as we look over the weeks and even months that we've been coming together, I think that increasingly we're getting a really good body of understanding of the issues we're dealing with. I'm going to share with you today some of the challenges that I've been involved in directly and indirectly, particularly over the last week. And I really want to dive into what I was doing over the weekend. I'm going to talk to you about some fairly acute issues that I'm involved in with a number of countries right now. And then I want to look ahead at some of the challenges that we face. I want to acknowledge, as always, the connections that I have with Tedros, the Director General of WHO, his regional directors, and of course the head of the emergencies program, Mike Ryan, and the teams with them. Of the team, just to give you quickly a little bit of introduction as to who's here. Sitting with me in my office here in Geneva is Catherine Deland. Sitting next door, leading mostly on food issues at the moment, is Florence Lasbens, our Managing Director. And I just want to acknowledge that John Atkinson is here with us. Thank you, John. Twee is here with us, Twee and Grian. And then we've also got other team members on, but I can't see immediately who is connected. Karen Kaplan, you've just joined. Thank you. Rebecca Cantor, thank you for joining from Chile. Lovely. Sudha, it's good to see you here as well. Michelle Effendi, really lovely to see you from the East Coast. Great. Miles, thank you for joining as well. And Paul Garner, wonderful to see the uptake on your really important work on long-tail COVID. So glad that you're with us, and they're waving. I know you can't usually stay on for more than a bit of the time, but if you do want to talk, Paul, then I'll try and give you space early on when I've said a few words. Do make sure you get your word in before you go, because I know that it's not easy for you to stay on for long on these things. Okay, now, first of all, let's ask Twee to open us up, as she always does. Twee, over to you.
Thank you. So we like to ask you 3 questions at our Open Online Briefing so we can get to know you and where you're joining us from. You will have a window popped up on your screen at the moment asking the first question, where are you joining from? Once you've selected the answer there, you can scroll down to question 2, the age range. And then question 3 is around how you're feeling today. Now this one, we've set it up as a multiple choice question. And you'll see the more positive emotions we feel at the top, and then the more negative emotions we feel at the bottom. It's our way of getting to know you despite being, and getting the feeling of the room despite being a virtual event. Thank you. Back to you, David.
Thank you. I'm just filling in my answers, Very good. Now, last week on Friday morning, I was quite clear with all of you that I'm trying really hard not to let my understanding of how the pandemic is evolving be totally guided by the numbers of cases and COVID-related deaths that are being produced from countries around the world. I said it's probably best just to assume that this virus is lurking everywhere. And if we give it a chance to, it will multiply and it will form spikes and then surges. And we should just not assume that anything that we do will actually make the virus disappear. Instead, we should hold in our minds that the key to the security of human populations in the future lies in our collective ability to hold the virus at bay. And when I'm saying it, I often find myself putting my hands up, hold the virus at bay. And that's because there's no evidence that this virus is suddenly going to change the way it behaves. And actually, as long as we keep recognizing that the virus is the enemy and that humanity is the solution, then it's much easier for us to just understand that holding the virus at bay means holding our hands and our hearts together and creating as many impediments to the virus spreading and undermining our societies as possible. Now, creating impediments can be done in various ways. Obviously, we can create impediments as people by reducing opportunities for the virus to be transmitted. And that means these 4 precautions that we keep talking about really matter. Physical distancing, I put top of the list because all the evidence is that if you're more than 1 meter and ideally 2 meters apart from other people, it's really hard for the droplets, if they contain virus, to actually come into your own respiratory system. Not impossible. And I know that we are worried that perhaps the virus can spread on shiny surfaces if there's a lot of it around. I know that we're worried that under some circumstances, the virus can be blown in tiny particles and travel more than the 2 meters. But all my colleagues in WHO who are studying this say that the vast majority of transmission can be explained on the basis that it's in small droplets that usually fall down to the ground within 1 meter and almost always fall down to the ground within 2 meters. So we keep the physical distancing there and we don't drop away from it. And then we add that extra important element of face protection. I'm more and more convinced by the people who say to me, actually, David, the manner of face protection matters. And we've got some engineer friends who are telling us that a surgical mask covered by a cloth mask is probably the most efficient way to trap most drops. I should have probably got my mask out. It's in my little bag and I could demonstrate it to you, but I think you know what I mean. A surgical mask is the mask that your dentist or dental assistant wears. Here's Catherine's got one. She just wore it coming here. That's the surgical mask. And then over the surgical mask, you put the cloth mask. And the feeling is that that probably is more effective than just a cloth mask on its own. And always remind people, mask over nose, please. None of this mask below nose. It doesn't work. And then having got the physical distancing and the masking, always the hygiene. You know, don't forget the hand washing. Don't forget the proper coughing and sneezing. Don't forget keeping surfaces clean. It matters. It really matters. And it's just something that it's so simple, but I want to encourage it more and more. And then fourthly, and the one that I think is becoming more important in my own mind, is staying away from other people if you've got the COVID symptoms. You know, if you've lost your sense of smell and you're beginning to feel rough, get out the way. Don't go anywhere near other people. And of course, if you're poor and you're working in a situation where you have to keep going to work because otherwise you can't pay the bills, that's when the problems get really serious. And so we've been doing such a lot of work over the last week or so on really trying to understand what are the challenges for poor people in putting these practices into place? What are the challenges for poor people on physical distancing, especially if their employers are not letting them introduce physical distancing into their work practices? What are the problems for people if they're prevented from doing face masks, either because they themselves feel that it's some kind of loss of freedom or masculinity or something if you wear a mask, or they can't communicate properly because they use their lips, or they can't share their emotions with other people properly. There are many people who just cannot wear masks. They find it just too constraining. So I think we have to be understanding of that. And then what about the people who've got no water and just can't do hygiene? And what about the people, as I say, who are just prevented from staying away from work when they're not well? So I'm actually really keen now, as Twee knows, and as I think many of you know, to turn this business of precautions, what I call universal precautions, into a global campaign. And I think all of us need to be part of it. I'm really keen that our friend Gabrielle Fitzgerald from the Pandemic Action Alliance is starting a really massive campaign on masking. And I don't personally want myself to be initiating any campaign, but I want to be seeding all over the world into any network of people who are being active, the notion that campaigns around these universal precautions are a really important way to go. Now that's one part of it. And so in my mind map of how I'm dealing with this, I have the second part in my right hand about holding this virus at bay, as well as what we do ourselves. It's about what we require of authorities. And that's where I've really been working hard on trying to get the narrative right. Working a lot with colleagues in our team, we tried to move beyond talking just about public health and saying how important it is to have community-based public health services that work, that can interrupt transmission through finding people with disease and isolating them, can interrupt transmission and stop clusters building up by tracing the contacts and getting them to isolate. And yes, we keep talking about that, but it's not enough. There's too little understanding of what public health really means. People think, oh, it's some combination of hospitals and health centers. They think, oh, well, it's what they do. But I don't think that's right. I think we have to develop a new way of explaining public health, which is integrated, local level action for the benefit of everybody, i.e. everybody's health, that is done routinely in all societies. Integrated because you need to bring together all the different actors. It's not just the doctors and the nurses and the health officials. It's the local businesses. It's local organizations. It's schools, universities. Of course, it's also local authorities. It's the mosque, the church, the synagogue, the temple. And it's all the different entities in the community to whom people turn to for their identity. And what we need to do is to encourage a collective identity among all these actors for integrated local level action to pick up people with the disease and to make sure that we can interrupt chains of transmission and prevent clusters from developing. Cluster busting, interrupting chains, suppressing outbreaks, words that only have meaning if they are embraced locally by local actors. You can't do this if you're thousands of kilometers away in the capital city and there's a spike building up at local level. It's got to be the local actors working at the interfaces, creating trust, trying to avoid these terrible bust-ups that we see sometimes between central authorities and local authorities, trying to avoid the political tensions when the local authority belongs to one party and the central authority to another party. You've heard me talk about how deeply we are getting immersed in some of the debates in the United Kingdom about test, trace and isolate and the need for that to be done locally. And we are immersed in that really acutely now, participating in joint debates on British television with local leaders. getting agreements with them about how important it is, participating with people from national government in Ireland, in Europe, continental Europe, in North America, in Australia, in India, on the importance of local level action. It's not easy. There's so many already ingrained barriers between different groups at local level that lead them not to talk to each other because they don't like each other, not to talk to each other because they're fighting about money, not to talk to each other simply because over the years they've had animosity, they've never spoken to each other. And then there are some who say, we're not going to work with the local businesses. More fool them, I say. If you've got outbreaks in your sandwich factory in Melton, or if you've got an outbreak in your fish plant in Accra, or you've got an outbreak in your meat plant in Australia, you've got to work with the local authority because your employees go home or they go to their digs in the local community and they'll take the virus with them and vice versa. So we are obsessed by what we're calling integrated local level rigorous action. We're obsessed with power being available at the local level so that there can be restrictions on movement at the local level without it creating a great stink across the country, because we know that actually restricting movement is a key part of being able to dissect what's happening in an outbreak and to be able to close it down. But to do it in a way that does not stigmatize the people involved, because, as I said at the beginning, people are the solution. The virus is the problem. And staying ahead of this virus and holding it back is the key thing to do. And remembering all the time that for poorer people, who often belong in many societies to ethnic minorities, for poorer people, this is hard. You know that we've been working on 7 strategic principles, starting with the people, going to local level action, going to public health services being properly organized with good testing and everything like that, with essential health services being maintained so that people with cancers do not miss their treatment. Reading the headlines in Britain again, prostate cancer sufferers not getting tested. This is awful. I want hospitals to be working. I want schools to be functioning. I want universities to be teaching their students. I want businesses to go on working and not closed every time they have a case. I want places of worship to be open and welcoming people. I want society to go on, because to ask people to stop and to go into lockdown just immediately provokes incredible poverty, hunger, malnutrition, despair, anger, irritation with government. And that is not good. So to be in a situation where we are portrayed as presenting this as either public health or the economy is just belittling what it is we're trying to say. I've just been talking to Swedish colleagues. I'm saying, don't misrepresent. It is not herd immunity, or it is not either or. It is not a binomial situation. It's both and. It's get the public health right through integrated local level action and people being fully involved. What we're listening to people in Greater Manchester talking to us the other day, they said it's got to be community led, otherwise it won't work. Yes, I said, but you've got to do that so that business can get going again, so that life can pick up. Otherwise, the situation for poor people throughout our world is going to become worse and worse and worse. And I don't want any part of that. And I don't want you to be any part of that. Talking today with some people who were interviewing me to prepare for some TV thing, they said to me, why are you doing this? Why are you so passionate about it? And I said, I've been working in development for 40-something years, 45. And I've been committed to people everywhere having equal opportunities. I don't want poor people to face more misery, suffering than wealthy people. I don't want there to be one world for the rich and one world for the poor. I hated that all my life, even though, of course, I'm well off, but I still believe in equity and I'm working for equity. And I think those of us involved in this COVID story have got to get the narrative right. Otherwise, there's no chance of equitable development. If it's constantly presented as a choice between economy and public health, I tell you, poor people will suffer. It's just the way it will go. So finding that combined narrative that provides us the basis for holding the virus back is key. And ensuring that essential services can be maintained, ensuring that those who work in essential services are kept healthy, and ensuring that communication is clear and consistent, unequivocal, no doubts, no uncertainty, but absolutely clear, with shifts being made when the science tells us we must shift, and we can be honest about that, but otherwise we should all be talking the same narrative. That for me is key. And then built into that, all the time invoking my guru on this, Dale Fisher in Singapore, we need to have a very good dashboard of probably about 7 indicators of how well society is coping with the virus. Just go through it again. 1, everybody adopting what I call the universal precautions. Number 2, integrated local level action. Number 3, public health services that work. Number 4, hospital capacity and essential facilities from hospitals open and not closed so that everybody can get what they need for life, especially women. Number 5, all those who provide care, accessing personal protective equipment and being able to keep safe, and avoiding the situation of hundreds of health workers getting sick and dying all over the world. Communication that is clear and consistent, and then good dashboards with performance indicators that show how we're responding. I thought, before I finish my introduction, that I would just like to share with you some of the things that we've been working on during the past few days to try to make the point that this is alive and acute, and all of us need to be emissaries for this message of getting the health right so that the economy can function, getting the health right so that social life can function, getting the health right so that all of life can work. First of all, I'm saying to people, yes, I'm expecting numbers to be rising in Europe right now. I'm not scared about it. It was what we knew was going to happen because of the way the virus is and because of the fact that people are having to start moving again. And we have to live with this reality that there will be spikes and surges. What we should be trying to test is how good we are as humanity in holding them back and keeping that virus at bay. And that means we have to be able to find the spikes and we have to be able to deal with them. As a German economist said to me when I was discussing this on the phone this afternoon, he said, it's a very difficult message. It's too nuanced. He said, you're not going to be able to get it across. I said, I've got to get it across. People have got to understand this. And actually, I find that in doing radio or television broadcasts, that I think the presenters do get it. And they tell me some of the messages they get in from their listeners and viewers. And I think they get it as well. There's nothing wrong with conveying complex, nuanced messages. After all, every single one of us is used to living a life where we're having to make complex and difficult choices and where we're having to weigh up alternatives, neither of which we like very much. But that's what COVID makes us do. It just accentuates the reality of difficult choices in life. So, inside this, I do want to focus on the UK government and their communications. I think they can afford a little bit of time in the centre of government, thinking hard about finding the right way to blend the message so that people do understand it. And they can afford to trust their citizens to cope with complexity and not revert each time there's a bit of a mess to saying, we've got to issue more precise instructions. It always goes wrong. Because if you don't allow local opportunities for people to work things through on the variances within the overarching strategic principles, you get a situation where people feel disempowered. I think there should be no doubts and no questions on physical distancing, masking, hygiene, and self-isolation. But whether you gather indoors or outdoors, whether pubs are open, yes or no, what happens in schools, whether a factory should close down when there's a case of COVID discovered, I think these are things that need to be worked through more at local level, through the involvement of local public health officers, because the conditions at local level are always different and it's super hard to second guess them from the centre. So I'm saying, that's what I'm saying to UK, but I'm saying the same to Israel, where there's been a long period of haggling between different local authorities about closing this and closing that. And I'm saying, okay, I'm sure there will have to be haggling and competition, but in the end, you're going to have to trust local authorities to find the right blend. And increasingly, we're going to hear businesses saying, we want to stay closed for a bit until we've got this virus under control, as has happened in, for example, Oldham in the UK. Because unless you actually listen to people at local level, the chance of being able to find the right way to manage these difficult decisions is very, very low. I was interested to see that a lot of attention is being created when individuals test positive and it becomes known in the news. So today, Christian Prudhomme, who's a director of the Tour de France in France, is director of the bicycle race Tour de France. He's tested positive. And I mean, I actually think it's very good that they've done that and that they've announced it and it's clear. I think it's good that Berlusconi is public about the fact that he was positive. And I'm very pleased also that other world leaders who are positive have been public about it. I think that's right. But I think that it would be so good if some of these leaders could actually, as part of the process of them coming out with their positivity, also be very good at conveying the message. On schools, I've been working with our team and with the team in WHO led by Maria van Kerkhove. And what we've been trying to do is to see whether we can come out with an amalgam of the current situation about schools with a view to providing reassurance to ourselves and to others on how a school should be able to stay open, even if there are some positive results reported from children or indeed from school teachers. And I'm looking all over the world now and seeing there's a big, big difference in habits. Not all schools are closing as soon as they've got 1 or 2 cases of COVID among their students or staff. Good. And then I'm looking at obviously other situations like residential care for old people. Again, can you stay open when you've got cases? It's very tricky, but again, through local work, it should be possible to find that out. So what about universities? There's a lot in the news about US universities opening and closing because they've had a big rush of COVID as a result of students returning. What is our position on that? Well, again, I think we'd like to be able to work with some university chiefs on what techniques you can use to stay open, whilst at the same time you're dealing with an outbreak of COVID and you're dealing with a cluster. And I certainly think that applies in universities in Europe as well, many of which are gearing up to receive their students at this time. I was pleased to see a number of countries have really heeded our advice to them to do everything possible to avoid national lockdowns and to see themselves instead as becoming COVID ready. We've had quite a lot of interactions with New Zealand, mostly through radio and journalism. We had a pretty tricky time with Magic Radio, as I mentioned in an earlier briefing, which interpreted a remark that I said on the 26th of August as somehow criticising the strategy that the government have adopted to do movement restrictions in Auckland, and I wasn't doing that. I was saying, you want to try to avoid a national lockdown, but you may have to do local movement restrictions as part of the process of working out how to get on top of an outbreak. And the Auckland one was particularly complicated. It wasn't straightforward. And then I'm finding the same in other parts of the world as well. In Ireland, I've been talking a lot with different actors there. They've had some tricky times recently, government shifts and so on, associated with challenges around obeying the lockdown rules, as they're called. But it's been very, very interesting listening to the Irish reflect on what they're having to do. And again, the challenge they keep saying to me is, well, we've got an outbreak that's been driven by a lot of partying by younger people. Shouldn't we be issuing much stronger instructions to young people to stop it? Well, I'm saying, actually, I don't think that will work. I think in the end, we have to engage young people in thinking through what it is to deal with COVID. I quite like one part of the UK's communication that has said to young people, you know, do think about the older relatives. But my own view in this constant anxiety we're hearing about the young not obeying the rules, my view is, as we're doing in so many other settings, engage them in working through what the response should be. Don't let it be just telling them all what to do. So moving forward, I think that globally, humanity is working out how to live with the constant threat of this virus. I think that we can get really depressed if we spend our whole time just looking at numbers and at graphs going up, as many of my colleagues in India are doing right now, and say, is this ever going to plateau? I think far better, we should be focusing on the steps that each community needs to put in place to get ahead of the virus and hold it back. And I want to talk about that now. I want to talk about shifting the narrative and continuing to shift the narrative, trying to do it without getting bored of our words and trying to bring as many people on board as we can, doing it all the time without fail. I'm not going to stop, and I don't expect you to. Twee, who's here? Your moment.
Who is here? So I'm sharing the results with you right now. You can see we've got most people joining from Europe, and given the time of day it is, it's great to see people joining from Africa and the Americas, Latin America and Caribbean. In age range, always good to see that we've got at least 1 or 2 people from each of the age ranges, and 4 under 30 today, which is great. Zara, you're not alone.
Ah, Zara's here. Brilliant.
and on how we're feeling today. Always good to see that the majority are in that sort of upper positive emotions. And we do have a couple people feeling overwhelmed and discouraged. So this is where I say it is okay to talk about how you're feeling, to connect with one another. And for those of you who don't know, we do have a private LinkedIn group where I share a lot of the conversations, the links that we're posting in the chat at the moment, so you can keep the conversations going on after these briefings. I'll put my link to my LinkedIn in the chat box, so if you want to join the group, please just send me a message. Thank you.
Thank you very much indeed. Long tail COVID is now becoming established in our understanding of the natural history of this disease. And on the call is somebody who's really taken a leadership role on this, somebody who I would like to give a massive shout out to and a big Zoom hug to, Paul Garner. And I said at the beginning that we are careful with Paul because he, and he'll explain why, but Paul, just thank you for all you're doing. Tell us a bit about your last few days and how you've been able to take this forward. I'm seeing a very interesting article on BBC News today, which quotes your work on long COVID and identifies the need for greater health service support. I saw the UK Secretary of Health has talked about it. I had a comment from Mirta Roses, who's WHO Special Envoy in Argentina, saying she's seeing and hearing about long-tail COVID throughout Latin America. And I've also had many people from the US, including another colleague who's on this call, who I'd like, Sherry, if you want to speak at any point, you are very, very welcome to. Just indicate so in the chat and I'll call on you. But I'm hearing from the US as well. Long-tail COVID is being found there as well. What's been happening in your important crusading work, Paul?
Well, I'm still a bit ill. and one of the things that I personally have found out is that if I overdo it, I make myself unwell. And in fact, when I became unwell, the predominant narrative in the UK from our Prime Minister is that we will beat this virus. That's what he said on the television. And when I approached my convalescence, I decided I was going to try and beat it. I was going to drive it out myself. I'm a driven person. I was going to walk 3 kilometers one day and 4 the next and 5 the next and get better. And each time I did that, I was thrown back into bed. So actually it was Peter Hayward who said, why don't you should stop trying to dominate the virus. You need to accommodate it. You need to do a deal with it. You need to and that's actually quite helpful. I mean, it almost extends to public health, where we need to work out how we can live safely with it and not eradicate it. It's got parallels there. It's not complete. So, and because GPs initially didn't recognize it and everybody saw it as a short illness, and there's no test because it is so equivalent to chronic fatigue syndrome, myalgic encephalomyelitis, which has been dismissed by doctors for years as a psychological disorder. There's been a bit of work to be done there. So that it is moving forward. But I think the need really is for now for good guidance for people. And because long COVID affects the heart, it affects your mind and affects your health and your well-being, people are accessing different specialities, and there's a real need for clearer guidance for people, with medics working together on working out what research is coming out and and how to manage and treat people. And fatigue has been terribly badly managed by doctors generally in the past, much better by occupational therapists and others. We need the messages from the chronic fatigue community mainline for people like me to help. So there's lots of work to be done in helping people help themselves get better. And your message about communities is also very important, because there aren't any wonderful drugs. In fact, what you need is psychological support of the people around you. And there's somebody in the garden now who is a person that we support each other in getting better. Thanks for giving me the floor.
Paul, just one question. Is the virus still in your body?
No. So so early on, David, and you and I had these narratives, is this post-viral? And we were always concerned because there were these late complications, young men getting strokes on day 30 or day 40. But all the work that I've seen is that the virus is not there, but the effects are very clear. So it is so similar to chronic fatigue. I mean, it's almost the features are so similar to people after Epstein-Barr virus and these other post-viral conditions that I don't think that risk of infectiousness is there. But the one thing I would say, with the winter coming up in the UK, is what is happening is people that have this relapsing illness, which is what I've got, when they get an intercurrent illness, like a fever or a cold, it brings back the COVID symptoms. So there's a rash of people at the moment thinking they've been reinfected, and actually all it is a relapse consequent on other viral infections. So we haven't even unpacked that one yet, but that is going to be the next panic in the public.
And lastly, I was reading about myocarditis in sports people. Presumably that's all part of the same thing, that then is to the epithelium around the heart.
So what is that's a good example, David, of where you've got specialists doing tests on subgroups of people, and there being zero connection with the rehabilitation services. So these papers were coming out of myocarditis at the same time as the NHS had on its COVID rehabilitation website, dig out your bicycle and get on your bike and get going again. It was, I mean, it was dangerous advice, because there hasn't been the cardiologist talking with the primary care people, talking with the rehabilitation people about how you should screen people or what you should advise in a sensible way without over investigating and so on. That hasn't been done, but it can only work if these people get together on a conference call and bring out some guidelines tomorrow, not in 6 months' time, like NICE might do, or a year's time. We'll all be dead by then, or it certainly won't make any difference. So certainly, guidance in real time is really important to do rapidly and appropriately.
Everybody, that's Professor Paul Garner. He's one of the brightest public health doctors I know. He's worked building up something called the Cochrane Centre, which is a whole device that's been developed over the years to make certain that medical knowledge advances in ways that are based on evidence, and that hypotheses are adapted once you get new information. It was Paul who, as far as I'm concerned, was one of the early people to draw attention to long COVID, and has approached it with the same evidence-based scientific analysis that he's done with every other issue he's dealt with in his distinguished career. And Paul, I salute you for what you're doing. And I know that probably in a minute or two, you're going to say, I'm too tired and I have to go off. I know that. And I know that you're still ill. And I really thank you and the thousands of other crusaders for getting long COVID understood. I really thank you for it. And then obviously, colleagues, Paul, we don't want to overload you with stuff, but I know that if anybody wants to communicate with me or with members of our team, we can find a way to bundle up and share with Paul. And Paul, thank you again. Yusuf, thank you for connecting with us, and thank you for being on these moments. Yusuf Gottlieb, I think that it's important that you get the next say. Yours is a more general point, and it actually reacts to the way in which we connected over LinkedIn and stuff. But I'd quite like you just to spend not too long, but just a couple of minutes explaining who you are, and then please make your point. Yusuf Gottlieb, you have the floor. Oh, that was meant to be a really fancy handover to Yusuf, but I think he may have fallen off. Yusuf, are you still here?
Thank you, David. This is Yusuf Gottlieb from Israel. I work on the interface of integrated development, integrated rural development, and climate change. And the current COVID crisis and COVID adaptation is certainly inextricably connected to that. And I'm very grateful for this opportunity to share with this international community. I'm fully behind the initiative and fully support David's comments about solidarity and concerted activity. My brief comments, concerning what you said, David, is that the precautions that you've mentioned are scientifically vetted, they're logical, and they seem to work. And I think that they're the correct ones. And I wish that the world was in a place now where we could adopt those precautions universally. But I see three obstacles that have emerged that we have to address to having the universal application of these precautions. That is dissonance that arrives from three sources: the erosion of public trust in authorities, particularly due to the political management rather than the scientific management of the crisis. The second one is an emerging dissidence in the medical and scientific community, particularly around herd immunity, where people still think that that's an option that should be pursued.
Yeah.
And the third one is public fatigue. People are fatigued by hardships, both material and emotional. And I'm observing that in Israel, where I live, and also in Central America, where I've been working for the past 3 years. Thank you.
Thank you very much indeed, Yusuf. It is our job, I believe, in our small way, to actually address at least two of these issues. The issue of public trust in authorities, and also the dissonance that is currently existing in science. Both of these, I think, are accessible to people like ourselves because we just have one credo, and that is to work for the good of humanity. And I find myself very influenced and inspired by the way in which you are working and wanting very much to work in support of you. I hope we can stick together, and I hope that if you find this worthwhile, you'll join the LinkedIn group that TWE has set up, if you haven't already done so.
I certainly will.
Thank you, thank you. I'd just like to send a word to Chris. Chris, how are you getting on? How's your illustration going? Do you want to, Chris Shipton, do you want to quickly let us see Chris's screen, see how you're approaching it? I think that it's good that in the right you've got space for some of the issues that have got to be addressed. And Chris, if there's anything that you're picking up so far that makes you think either the logic is good or the logic is clumsy, let's have some help. Thank you for the clever things you've done on the virus is the enemy and the people are the solution. Over to you, Chris, for any comments. Chris, you're on mute. Well, I think you may.
I just did the school pickup today, and our school has gone to huge lengths to get all the parents queuing around the block. And we sort of stream through the school in a big sort of S pattern and out with our children. But no one is wearing masks. And I've messaged the headmistress, and she says, well, we are asking people to wear masks if they could. And she's in the unenviable situation of not wanting to alienate parents who, you know, and she doesn't want to get in an argument with them. And I think this all comes back to leadership from the top. You know, if she has like if there's a government department or a senior politician who says, everyone just wear masks, then she can just turn around and say to the parents, everyone wear masks, but she can't because people argue the toss. And I just don't understand why that can't happen.
Chris,
but
my vote.
And I'm still puzzling on it.
You have my vote. You know, if boss don't give clear guidance, we're in trouble. I was doing a thing with Sky News this morning, and the person said to me, Kay, I've forgotten her name, but Kay Burley, that's right. She said, what would you do if somebody's not wearing a mask on a train or in a bus? And I said, I'm a bit conflict averse. I don't really like going up to people and making comments. I suppose also I'm a bit nervous that somebody might assault me. It's very difficult for people to actually make a stance on these things unless there is a strong position taken by the bosses. And all this stuff of, you know, you should wear a mask if you want to, but if you can't bear, you don't. That's no good. But Chris, we'll do it. You're joining the campaign. Very, very good.
Will do.
I'd like just to say to Sherry, if you want to speak, I would love to welcome you. Carlos, if you want to speak, I'd love to welcome you. I'm going to give the opportunity to Florence Egal, who's joined us. I haven't seen you very often on these calls, but we've worked on many other issues. Florence, you've got another point. You want to take us in a different direction. And I'd love you put a comment in the chat. I'd love you to say it, and then perhaps we could have a little discussion on it. Florence, you have the floor. Florence, I can't see whether you're still on. It may be that you've...
Yes, I am still on.
Yeah.
Okay, so I said beyond being an ex-public health person, I'm a very convinced European. And I have been wondering since the start how long we were going to go to have governments in Europe doing things in complete isolation and treating all their territory as though the problem was the same in all the country. And we are going on having countries that are making decisions on whether their citizens can travel or not travel. And I was wondering if there was any discussion at the level of Europe, so that these discussions, if we get instructions that make sense and we don't get the feeling that everybody does what it pleases at the moment it pleases, I think it would be easier to get the trust of the public.
Thank you. And Florence, the answer is I am with others doing everything that we possibly can to develop some indicators that all countries can use so that the decisions about travel in Europe can be better based on metrics and less based on combination of anxiety and other emotions. The metrics have to not be about numbers of cases, but have to be about how the spikes are being handled at local level. Because if you've got good capacity to deal with the spikes, then you don't have to worry so much about whether you've got an increase in cases, because at least you know that you are going to be able to suppress outbreaks and manage them. We're still a bit of a way away from that, but I couldn't agree with you more. Why on earth do we have political instruments like the European Union if you haven't also got better working between countries on this kind of thing? So watch this space. It's something that I shall advance on your behalf. I'm just warning Joe Nichols and Zara and Miles, I can see you there, Miles, I think, that you may be asked as well by me for your latest take of what's happening in your part of East Africa. So don't hesitate to give us a sign if you want to be called on. Going to New Delhi, N.K. Sethi is a regular correspondent on these briefings, and he's going to say some very tricky questions to me. I was always tempted, N.K., not to ask you, because this is a tough one to answer. Here you go, N.K. You could say it, but if you could say it fast, then that gives me a chance to react to it. Over to you.
Thank you, Dr. David. Well, my questions were related to what to do when the health system gets overwhelmed and shows signs of collapse. You know, what we are interested in is to take care of COVID cases as well as non-COVID cases. But we have observed at places in India where this balance gets disturbed and it becomes chaotic. So yeah. I'm not sure what kind of a best intervention would be best. To my thinking, if there is some criteria which is developed, which could be thought of, if I am allowed to suggest, maybe I can verbalize it. I'm not saying that it should be the criteria, where the cases are rising, and where the systems are overwhelmed and the cases are rising at a rate of more than 3 or 4% per day on an average, where the positivity rate is more than 10% on an average, or where the case fatality rate is above, let's say, 2-3%, depending on the local situation, how best they can handle the situation. So there, besides local movement restrictions, I feel that some kind of a little more stringent efforts may be required.
Yeah. Well, first of all, if you've got more than 5% positivity rate, and if you've got a case fatality rate on detected cases of more than 2%, then this is suggesting that the thing really is advancing and it is not a good situation. So I can quite understand under those circumstances that health systems are likely to be overwhelmed. And this is the situation, as we know, in parts of India right now. I do still think that every possible effort must be made, first of all, to protect health workers who are in real danger when you get this sort of situation. And secondly, to try to create services that are as free of COVID as possible, particularly for the continued needs of women and children, because all the evidence we have from different settings, even with COVID now and previously with Ebola and other conditions, is that if you don't preserve parts of the health system for other health conditions, very quickly the health system gets closed off and people suffer and may die, or certainly suffer and may be otherwise disadvantaged as a result. So I really would like to suggest that in that kind of situation, stringent efforts be made to cordon off a part of the health system for maintaining non-COVID care and keeping health workers who are working on non-COVID care safe. I'll try and get some guidance for you on this, NK. I know how to reach you, both by WhatsApp and by email, and I will put this top of mind. I'm now moving to Nairobi and to see if Joe and family want to say a word or two. I'm very happy for Zara to be the correspondent if she wants, but either way, it'd be lovely to hear from you, Joe, Zara, or Miles.
Thank you very much. I think, as you know, I've been working in Somalia, and one of the strange new developments there is that people seem very, very fearful about catching COVID from animals, but also about their very valuable animals potentially catching COVID too. So it just is interesting because that's not what we've been hearing in previous weeks. So just to add to the mix. And yeah, Zara was going to just say a quick word about homeschooling.
I've been doing Zoom school for 2 weeks now, and I still miss hugging all my friends. We're very lucky to have computers because most people in Kenya don't have them.
Thank you.
And yes, schools here are still shut until January.
Oh, I see. So you're having to do it all through Zoom. You're very lucky because you've got a computer and you super miss being with your friends. It must feel weird. I mean, it's good for your parents. Anyway, thank you. And thank you for reminding us, Joe, that different people have different constructs and perspectives on these things. I've heard from several communities that there are people saying, we are wondering whether our animals are going to get this thing and whether it in turn is going to lead to our animals dying, because if they do die, then it's like losing our money in the bank. So thank you very much indeed for that. Carlos and Veronica, I just want to know if you, in Cancun or in Mexico more generally, does it feel better these days than it was a month ago? It was very, very bad a month ago. And, you know, I've lost a very great friend of mine, a Mexican, Claudia Lomo's mother's just died. And what I'm hearing is that the situation in Mexico, the death rate is still high, health workers are suffering. But what does it feel like from where you're sitting?
It's still very bad. We are worried. The numbers are very high. But as you say, in the last week or 2 weeks probably, numbers are being flattened. Yeah. Not in a good way, not in the way we would like, but there's a certain hope that things get better. I don't think so. We're opening, and I still think we should wait for a wave to come. So that's the situation right now.
So Carlos, thank you. I think your instincts are right. When you've got as much virus in society as you've had in Mexico, because of the way in which the outbreaks were dealt with at the beginning, you have to be super careful with this relaxing. It's tempting as the numbers start coming down, you think, oh, well, let's open up quickly. But that's the most dangerous time. And I can quite understand why there's concern. And also, I would suggest very strongly trying to get as much detail as possible about where the virus is in the country, because it won't be the same everywhere. And that does mean that you might be able to be more relaxed about increasing movement in certain areas where there's not much virus compared with others. Super difficult to government. Thank you.
Yes, you're right on that. And Mexico is a very diverse and very complicated country. And probably some regions don't even know there's a virus going around.
Yeah.
And that happens.
Well, there ought to be public information about where the virus is. I think that is part between people and the state, is making certain that the folk know as much as they possibly can about where the virus is. It's wrong if it's just kept in one place and hidden. And Thank you for that, Carlos. So it says Bob Schneider on your thing, but I think that's the wrong name. So whoever is on the thing with Schneider on it, I want to give you a moment to speak. If you could unmute, I can see you talking, but you're muted. So just unmute and then you can, yeah, here you go.
There we go. Well, thank you very much. We live in a community that currently is having a surge. We've got a rate of 8.8% currently. And people are really resisting restrictions. We have some people who are violent and are actually pulling guns on people over telling them to put on a mask.
Yeah.
And it's a very bad situation that we're having. And we run Walter Schneider, the other Schneider in here, and I run a group with 14,200 people in our area, and we're starting up a campaign to put on masks and to follow restrictions. And already just even talking that we're going to be doing that, we're getting a pushback from this anti-mask movement. And, you know, I don't know if that's local to the United States because I'm not going to get into our political leader at the moment. But, you know, we're not getting a lot of leadership from elected officials on the issue. And my question is it going to take the grassroots and what grassroots resources are available to us to go against the politicians and to promote good behavior?
So Bob and Walter, it's going to have to be grassroots. Which part of the country are you in?
We're just south of Chicago, Illinois. We're in the American Midwest.
Okay. You're going to have to, I'm afraid, do it from grassroots. It's going to have to be a global grassroots campaign. We have Michelle Effendi on this. She's a campaigner. I'm very much hoping, Michelle, that you're hearing this and that you'll be able to stimulate as much as all the rest of us can do. A grassroots campaign on face masking is about the best thing that we can offer the world. Thank you very much.
She is our principal resource, Michelle is. In fact, I want to adopt her. You know, she's wonderful. So.
I just want to say to Michelle, I hope you're blushing. I can see you're smiling, but I can't see you blushing. John's giving you a thumbs up. Michelle, you're a hero. Leave it.
Yes.
Thank you, Michelle. Everybody, Michelle Effendi is one of these people who runs massive communities through Facebook, and she does them throughout the US, and she's a total hero.
Globally.
Globally, even better.
Globally.
Sherry, are you on? Sherry is somebody I've worked with on many different communicable disease issues. She's a journalist. She works, I won't say which particular newspaper she works for, but she's one of these people who wins prizes and turns heads. Sherry, are you here? I can't see whether you're here. Oh, well, yeah, you are. Sherry, do you want to just say a word before we close? No, I've lost you. It's very...
Are you able to hear me?
Yeah.
Hello?
Yeah, here you are. Sherry.
Oh, okay. Yeah, I had to turn off the computer, so no video, but hi, everybody. Thank you. It's really wonderful to join one of these for the first time. And I am working on a project the plan is to result in a book and looking at different countries that have had very different experiences, comparing and contrasting. And so I would welcome people's thoughts of places to look that maybe haven't been looked at so much. And I'm just logging back on my computer to see if I can I put my email in the what do you call it, in the Zoom link, or is it a public thing that I shouldn't do that?
Sherry, put your email in the chat. Use the Gmail if you want. And we don't need to say more about, I mean, all I want to tell you is that this is some powerful journalist you're hearing from. And she's going to write a really interesting book comparing experiences, but in an unusual way, trying to focus on where the strength is, where the community movement is, where the change is coming from, and not simply just get it out of the voices of those we normally hear from. And so,
exactly.
I hope you'll put your email in
yes,
there.
I'm just trying to, I'm logging back in. Let's see, 6, 7.
But what I'm going to do is just tell everybody, I'm going to tell my team that it's sherifink@gmail.com. Sherry Fink, all one word, @gmail.com. And please, please don't hesitate to be in touch with Sherry for this piece of work she's doing. She's really trying to get the experiences from where people are. And I was just thinking, as Bob was talking about the campaign that he and Walter are doing, and I hear from Michelle from time to time about what she's doing, it's real people doing real movement, showing how real transformation happens, need to be heard, and to have Sherry with us and doing this project is so important. We're going to stop now because actually we have to move on to another thing, and you all have to move on to other things. What I learned from doing these, especially now that we've got to know each other so well, is that there's lots to be said all the time. There's so much experience to be harvested. And I'm really, really grateful to you all for joining. I'm glad that you find it okay in the format. I'm so pleased that you're here. I want to give a special shout out to James Ritchie and to thank him for giving us the opportunity to do work on COVID in cold food processing plants. We just written some ideas for James and his colleague, and we hope that they're useful. I want to thank all of you who have been keeping in touch with us and who've connected with us, suggesting that we take part in seminars. I want to say a special hello to Karen Kaplan and what you've been suggesting. Iman, thank you so much. And Ruti Besuda, thank you for staying in touch and for helping us. I think that Chris has just made an extremely provocative command and remark as our live illustrator. I think I personally am not arguing for vaccination to be compulsory. I think we just simply have to make it clear we've got safe and effective vaccines available and then encourage people to use them. Chris, you have the last word. Over to you.
I didn't realise I was being so provocative, but I'd be very interested to hear the arguments in the future event.
Okay, you'll keep joining us. And with that, just final words from our team. John, do you want to say anything?
It's great to see everybody here. Lovely energy. Catch you all next time.
Yeah, Catherine? Same. And Florence, I don't know whether you're there, but just thank you for joining us. And last of all, Twee, if you want to do a sign off, then we can go.
Big thank you to those who are in our LinkedIn group, Loy and others who are commenting on the campaign. It's from your feedback that we can grow this idea together. So I'll see you all on Friday or next Tuesday, same time, same place.
Thanks a lot, everybody. Bye-bye. Godspeed. Stay strong. Think of the inspiration of Paul and others. Remember what Bob and Walter are doing. And think all the time about Michelle and her campaigning. This is the way forward. Bye-bye.